Hi, I hope everyone is doing well. Thanks for joining us today. I'd like to talk to you about a very relevant topic, working from home. And what I would like to do is talk to you about how to prevent the top 5 wrist and hand and elbow problems. My name is David Way. I am a hand, wrist, and upper extremity surgeon at Orthopedic and Neurosurgery Specialists. We're a group based in Greenwich, but we also have offices in Stamford and also in Harrison. So thank you for joining us tonight. I hope you find these tips to be useful and really a way to prevent many of these problems that are so common right now. So I'm just going to jump right in. And the first topic, the first out of 5, is tennis elbow. I'm sure many of you have heard of tennis elbow. Most of you probably have even had tennis elbow. But I really want to dive into a few of the details about what this process is and actually a few ways to prevent it. So tennis elbow, a few quick facts. If you look at this image on the bottom left of your screen, you're going to see a diagram of all the tendons that emerge from the outer or lateral part of your elbow. So these tendons all have names, but there's only really one tendon that causes the major problem that people have, and it's called the extensor carpi radialis brevis tendon. You'll see this tendon emerge from the outer aspect of your elbow, and it goes down all the way to your wrist. So what is tennis elbow? Tennis elbow is very common. It is most common among 40-year-olds. It also is something that we often think of as a rite of passage. So rite of passage for many of us just means that it's a disease that's so common that it's thought of as just one other thing that you have to go through. So it is a very common disease. It usually happens in your 40s, and you can also think of it as self-limited. And this might be hard to believe while you actually have it, but tennis elbow, most of the time, like 99% of the time, is something that just goes away on its own. So it's very important to keep that in mind. In fact, that will help guide us in terms of treatment later on. So I'd like to move on to, and finally, it also is benign. One of the myths about tennis elbow is that you might get it from playing tennis, and you might get it from playing tennis, but it's not the only activity that causes tennis elbow. And this brings us into different ways to prevent it. I've been in the office back seeing patients now for the past 3 to 4 weeks, and I'm getting so many complaints actually of patients getting tennis elbow, not from tennis, but from using different exercise tools and different ways to keep themselves busy. And one thing that I found is pretty common is this grip strength instrument or exercise tool that people use. So you can find this on Amazon. They're cheap, and people are doing this because they think it might be a good way to strengthen your muscles, to get your forearms stronger, to do something with your time. But this is actually a big problem for tennis elbow. You know, repetitive gripping, using your hands with something like this can really flare up your tendons. And I'm seeing a lot of people come in with this kind of problem, with a tennis elbow problem, just from using this grip strength gripper. So I would at all costs really avoid this. It really is not necessary. Even though it might make your forearm stronger, it can cause more problems than help you. So I think this is something that I would avoid. If you really do want to do some activity that might prevent or give you some grip strength, I would pick up one of these. This is something called a TheraBand. There are many different types. There's no reason to buy a specific brand, but this is one that I just found on Amazon. It's a flexible bar, and the point of this is to do something called eccentric stretching. Eccentric stretching means that you're trying to put your tendons on stretch, and it's a special stretch that involves lengthening that tendon muscle combination as you put force on it. And we think of that as a way to really generate or perhaps heal those tendons that are painful in tennis elbow. So if you have to pick up something or you feel like you need to do something for your forearms, I'd use this flex bar or this TheraBand. And many times, if you end up in physical therapy for this problem, they have one of these tools at the physical therapist office. So for every patient that comes in to see me for tennis elbow, I always show them what I think of as the best stretch. And here you'll see two pictures. One of them is this woman on the top left, and she's doing a great stretch. And I found these images just by doing a quick Google internet search. You can search for tennis elbow exercises and you find everything under that. And one thing you do have to be careful about, though, is there's a lot of things that are just not right that you might find on the internet. So for example, when I did this search just prior to this talk, you can see on the bottom right of this screen that this person is doing a stretch like this. And although this might be a good stretch for the other tendons of your arm, this is not really for tennis elbow. So this is in fact usually for something called golfer's elbow, which is totally separate. So you won't really get much benefit for your outer elbow pain if you do a stretch like that. One thing I do want to show you that will add even more to this stretch, if you can see me, let me show you how to do that. You're going to bend your wrist down, just like in this picture of that woman. And as you bend it down, you want to actually rotate it outwards. So that's going to put those tendons on even more stretch, and you should hold it for maybe 10 or 15 seconds. Really feel a good stretch, and I tell most patients try to do it as often as you can remember, but as a loose guideline, I would work on that stretch maybe 10 to 15 times an hour. So very often throughout the day, and you really want to hold it for about 10 to 15 seconds. Okay, so let's move to number 4, something called elbow bursitis. Elbow bursitis is also very common, and I just want you to look at these images. If you look at these 4 images and just try to find something in common, and I found all of these images just by finding search terms like working from home or using computer. And if you look very closely and study them, you're going to see that each one of these people, as they're working, they're resting their elbows on the desk. And you might even be doing this now as you're watching me give this talk. It's so common and natural to do this. But the problem with this is it puts direct pressure on something called the bursa, which is this tissue that is almost like fat. And it's a cushion on the back of your elbow, the posterior aspect of your elbow. And over time, if you're doing this constantly, if you're on the computer, if you're on the phone, and you're constantly putting pressure on that part, you can develop something that looks like this. So the classic elbow bursitis picture is a golf ball or something very swollen on the back of your elbow. And you may not notice it right away. You might notice it maybe after a few days, or maybe if you just catch your elbow in the mirror and you see it. So this kind of problem can be annoying. It's not dangerous, but the only problem with having this for a prolonged period of time is sometimes the back of the elbow is dry. And if you have cracks in your skin, you can actually get an infection. So then it becomes a much larger problem and should be a reason for you to come in and see someone like me. But if you just have this, if you just have swelling of your elbow, the best way really to stop this from happening is really just to keep your elbows off the table. So in these 2 examples, you'll see that the way that these women have positioned themselves is such that their elbows are off the table. There's no direct pressure on them. And that way, there's no risk of irritation of that bursa. So the key tip here is really simple. Try to keep your elbows off the table. Or if you are in a position where you cannot do that, try to take breaks. Let your elbows rest. Don't put the pressure on the back of your elbow for a long period of time. And if you can, take breaks, let your elbows go straight and relax. Number 3 is something very common as well. I've kind of categorized all different types of wrist tendinitises sort of together. It's a very broad terminology for hand surgeons. But wrist tendinitis in general can be a big problem while you're doing things at home. And some of those things, especially during quarantine or when you're working from home, might be taking care of your baby or taking care of a young child. So take another good close look at these photos. By the way, this is my baby. His name is Adrian. He's on the right over here. But if you take a close look at these and from maybe your own experience, when you are picking up your baby or your child, that's a pretty common repetitive motion. And if you keep doing this multiple times a day, you can develop a pretty bad case of wrist tendonitis. And another name for this is something called de Quervain's tendonitis. So de Quervain's tendonitis is so common, we actually also call it mommy's thumb, but it's from repetitive activities. It involves two tendons in your thumb, and you can see those two tendons here. There are names for them, but really what matters is once you have a bad case of this, it can be a tough problem to treat. So when you do feel pain like this, one of the best ways to prevent it from getting worse is try to take some anti-inflammatory medication. So that could be something as simple as Advil or ibuprofen or Aleve. So any of these anti-inflammatory medications can help treat the inflammation that causes this type of tendonitis. The other way to treat it is to wear a brace. And there are so many different types of braces out there. The very most common ones are a wrist brace, like the one on the top right over here. This is a good one to use, and it stops you from moving your wrist around. So by limiting wrist motion, you can actually help relax and let those tendons calm down so there's less inflammation. You can also find some that include the thumb. So if you look at the one on the bottom here, this thumb brace is also a useful one and can be helpful, especially because the thumb is really what's involved in terms of the tendons. So let's look at the next case, something called cubital tunnel syndrome. Cubital tunnel syndrome is a problem that involves your nerves. So the nerves in the back of the elbow, the one nerve that's in the back of the elbow is called the ulnar nerve. And cubital tunnel, if you have it, can feel like tingling or numbness to some of your fingers. And this is often confused with something else called carpal tunnel, but they're very separate and distinct types of problems. Cubital tunnel involves the ulnar nerve, and carpal tunnel involves another nerve called the median nerve. So what you might feel when you have cubital tunnel is numbness and tingling in your ring, in your small finger, which can oftentimes, for example, wake you up. It can really feel like it's burning or numb or tingly. And these are problems that sometimes you'll notice when you're doing things, and sometimes it might be in the middle of the night. So one way to really stop this from happening is to just think about why it does happen. And if you look at these examples on the right of your screen here, what you'll notice is as these people are working from home, they're using their iPad, they're using their laptop, and their elbows are bent. And when your elbows are bent, if you look at the diagram on the left, the ulnar nerve, the nerve that goes around the back of the elbow, the one that we're talking about, really gets pinched. So just by the way our anatomy is, if you are bending your elbow, you're putting your ulnar nerve under more stretch. And if you do that for a very long time, I'm sure many of you have experienced this, your fingers go numb and you start maybe feeling some tingling. So it's really important when you're working from home, or if you're doing any kind of activity for a prolonged period of time that involves your elbow being flexed up, to just take breaks. Or the other way to prevent it is don't put yourself in that position. So keeping your elbows at less than 90 degrees, like these examples, instead of with your elbows all bent, can really help give relief for that nerve, the ulnar nerve. Okay, so this brings us to the final topic, carpal tunnel syndrome. Carpal tunnel syndrome, many of you have heard of. I think it's such a common problem that oftentimes people come in and think they have carpal tunnel syndrome, but they really don't. So I think it's important to kind of think through what this might feel like for you. For many people, for example, it involves using keyboards or typing. So I think especially now, as people are using Zoom calls, webinars, doing work at home on the computers, you're always in front of your computer, you're always typing. And one thing I wanted you to pick up on, if you look at these photos and really study them, is what is the position of your wrist and your fingers as you're typing. So the top left example is a good one. If you're using a laptop and you're holding your fingers kind of upwards like this, if you look at the position and the angle of the hand versus the rest of the arm, you can see this person is flexing, or what we call extending the wrist backwards, and that actually puts extra pressure on the nerve. And the whole problem with carpal tunnel syndrome is pressure on the nerve, the median nerve. So this is a great photo of how not to use your laptop. If you were to stay in this position for a long period of time, or if you're typing like this for a long period of time, you're putting extra pressure on that nerve, and you're more than likely going to develop some irritation and ultimately some carpal tunnel syndrome. Here's another good example, same problem here. This woman is using her laptop. It looks very normal to use your laptop like this, but really if you look at her wrists in the position of her arms compared to her hands, she's naturally kind of picking her arms up, picking her hands up, and that's causing the angle between her arm and her hand to be slightly extended, which again is putting some extra pressure on that median nerve, the carpal tunnel nerve. So some quick facts about carpal tunnel syndrome. If you look at the left diagram, you'll see that most people will feel numbness or tingling in the purple part of this screen. And this area that's more red on the bottom in the center of this picture really shows the problem, which is pressure on the nerve. And that pressure could be from using your computer, it could be from just positioning your hand in a certain way, and it can make your median nerve pinched and ultimately feel like it's falling asleep. A lot of patients come in and say, well, I don't really do a lot of keyboard typing, I don't do any kind of repetitive activities, and it still really bothers me, and especially it wakes me up at night. So that's just a reminder that you don't necessarily have to do something repetitive like keyboard or typing for this problem to happen. It could be really anything. For example, a lot of people gardening at home, as they're working from home, they often will have carpal tunnel syndrome, or if they're doing anything that's really repetitive with their hands. So it's not always just using the keyboard. This is a diagram that's pretty basic, but I think it gives you a few good tips on how to position yourself while working. We call this ergonomics, and basically what you want to do is position your upper body and your arms in such a way to put most of your muscles and most of your joints and your nerves especially in a relaxed position. So if you just follow along with me, for carpal tunnel syndrome, you really want to make sure your wrists are straight. So if you follow this person's arm, you'll see that the arm and the hand are in a rather straight line. In this case, hers are even slightly extended, so you may even want to consider doing a few things, for example, like raising your chair so that your arms are even more straight. Your wrists are even more straight when you're reaching for the keyboard. They did not point this out here. Well, actually, I'm sorry, they did, where they say elbows are bent at 90 degrees, but you do want to make sure that they're no more than 90 degrees. So one way to adjust for that may be raising your chair so your elbows are slightly straight or extended, so a little less than 90 degrees. And what they didn't really show, but I mentioned before, is you really don't want the pointy or the posterior aspect of your elbow on any surface. So if you are typing a lot or using the keyboard a lot, really make sure to position your keyboard in such a way that your elbows can be off the table. And that way you won't develop that elbow bursitis we talked about in the beginning. Here's another few examples. Many of you probably even have standing desks. I think this is a great way to really adjust your posture and also your ergonomics at home. A couple of things again to notice. I just want to point out in these examples, elbows are off the table, mostly because she's standing. In this example, fingers, wrists, hands should really be straight. And in this woman's example, her elbows are slightly less than 90 degrees. And when I mean less, I mean they should be straighter. So you don't want them more bent, you really want them closer to straight. Same thing for this man. His elbows are a little less than 90 degrees. And in this case, he really shows you how to rest your wrists and your hands in such a way that it's a fully straight line. So a couple of key summary items. Number one, keep your elbows off the table. A very simple, very easy solution to trying to avoid elbow bursitis. Doing that special or that best stretch that I showed you for your arms and your elbows can really help. That's really for tennis elbow, and it's a nice way to make sure that those tendons stay healthy and hopefully don't give you that problem that we call tennis elbow. Avoid using your wrist in any kind of repetitive motion. I know for me that was kind of impossible because while I was at home, I was taking care of my 7-month-old. But if you do have symptoms, take some Advil, some ibuprofen ahead of time, really to calm those tendons down. And if you really have to, you may want to consider using one of those splints that I showed you. Taking something like frequent breaks. It's very simple, but I think it can really relieve a lot of these problems, especially the nerve pinch or the cubital tunnel or carpal tunnel syndrome. So just giving your nerves a chance to relax and not be under pressure can really help a lot. This is the same for the tips for keeping your elbows straight and your wrist straight. So all those things are really meant to take pressure off the nerve. So we covered a few basic tips. I think we covered probably the 5 most common things I see in the office now. Everything from your elbow to your wrist to your hands. And I really do hope you find these tips helpful. If any of these items come up and they don't get better, that's a good reason to come in and see us. I think that sometimes if you have a severe case of any of these items, you may need some more than just prevention tips. You might actually need some treatment. So there's a whole variety of treatment that's something that we can go through in the office, but sometimes it's something as simple as a cortisone injection. It might be as simple as a physical therapy, but it'd be good to discuss this in the office. So with that, I welcome any questions, and what we'll do is we'll take a short break while I check the question and answer section. Okay, so I'm looking through the question and answer area, and let's just go through a few of these. All right, I'm going to start with, there was a question about tips for more ergonomic desk setup to prevent carpal tunnel. And I think we did cover this. I think the wrists being straight are very important. There was also a question about how poor typing habits can impact finger dexterity. This is a more complicated question. I think finger dexterity usually involves all the small joints in your wrist. So when you're thinking about how can your typing habits affect it, it probably is not a huge effect, but if you have a very aggressive typing method where you're constantly kind of banging on the keyboard, you can definitely irritate some of the structures like your joints and maybe even your tendons. So there's not a direct correlation, but if you're very aggressive about your typing and it's something that becomes painful, that would probably be a good reason to come in so that we can at least examine you. In most cases, typing habits don't really affect the hands and the finger joints so much, as long as it's sort of light, natural, average typing. I'm just running through the rest of these questions. There's someone who asked, I'm having pain at the bend of the wrist on the top side when I turn my wrist up. Can you recommend any stretching or strengthening movements? Sure. So, sometimes the pain in your wrist on the top side or on the back side of your wrist, not on the palm side, there are many reasons for this. So it could be something as simple as tendonitis, in which case, actually the best thing for that is really not strengthening or stretching, is really rest. So you might want to consider just resting it in a brace. There are other reasons for having pain in the wrist. So if it's something chronic that does not get better with the simple things like Advil or a brace, that might be a reason to come in and let me examine you, and that could help narrow down that list to something more useful. We do have another question that says, I've noticed pain in my shoulder from reaching for the keyboard and the mouse. Can this be relieved by proper posture while at the computer? I think so. I think depending on what type of shoulder pain you have, there are many things that do get better just based on posture. It's a little hard to pin down exactly what might help you, but in general, you want a relaxed posture with your shoulders and your arms at your side. So if your arms are unnaturally or artificially elevated, or if you find yourself in a position where you're you're really having to use your arms with your hands very high. That could cause problems like impingement in the shoulder, or maybe even some inflammation that leads to impingement. So I think it would really depend upon how extreme your angle of your shoulder is as you're working. I think if your shoulders are relaxed and your elbows are at your side, that's probably the best position for them. Another question, are ganglion cysts on the list? I didn't put ganglion cysts on this list of top 5, but that's an important thing that I think we should mention. Ganglion cysts, while they're not really a common occurrence just from working at home, you can definitely have ganglion cysts pop up. It can sometimes naturally pop up, like spontaneously, but sometimes people have it from trauma. So there are many reasons to have a ganglion cyst, but if you do have one, there are several different treatments. Some people, for example, just choose to live with them. Other people choose to have them aspirated or drained. So I think depending upon how much it bothers you or how you got a cyst, you may want to consider a few factors before deciding. That's also another good reason to be evaluated by a hand surgeon and just kind of go through the options in person. Okay, now I'm going to a few other questions here. One question is, when can one expect to see improvement in de Quervain's tendonitis by rest or anti-inflammatory? That's the first part. And is there ever an occasion when this condition needs more attention than anti-inflammatories and rest? This is a great question. So it's really important actually to think about this. De Quervain's is so common and the treatments we use are so simple, like rest and anti-inflammatory, but it can be very frustrating because the simple techniques like rest and anti-inflammatory usually don't help you for at least 6 to 8 weeks. So during that time, a lot of moms, for example, new moms, where this is really a problem, they really can't tolerate wearing a brace. So if you can't tolerate the brace, or if the condition gets worse despite using the anti-inflammatory and the brace, those are good reasons to come in. And that would be the occasion when this condition needs more attention, especially because it can be such a painful condition. I think a lot of people seek a little bit faster relief, and that relief is usually through cortisone. If you were to come into the office and you have this problem, we would kind of talk through the plus and minuses of cortisone and whether or not it's the right treatment, but that's the next step usually. Okay, so I think that's all the questions we have at this time. I do want to thank everyone for spending the time and watching us and participating in the webinar. I think that hopefully we provided you with some good tips. We welcome you to check out this video on our website, should you want to review it. That is at www.onsmd.com. And if you have any further additional questions, or if you're looking to make an appointment, you'll know that you should know that on our website you can make telemedicine appointments if you prefer not to come in. But we are seeing patients in the office. We have paid a lot of special attention to making sure it's a safe place to see patients, and we welcome you to see us there at any one of our offices. Thank you.